Go. Good evening. Welcome to the expert series organized by the Spectrum-Autism team. The series is designed to create awareness about autism and the role of the community. Hi, I'm Hema from Tanjavur. I've been child educator for the last 14 years. I welcome you to the 39th episode of the Talk to the Expert series. Our guest tonight is technocrat and a founder director of Amaze Charitable Trust, Mrs. Akila Vaidyanathan. Mrs. Akila Vaidyanathan has started as a founder and the director of Amaze Charitable Trust and is helping family navigate the autism maze. And she's also a vice president of Autism Society of India South. She's a facilitator, a mentor, specializing in parent and caregiver wellness, and a parent of an adult with autism. Above all, she's a wonderful woman. We're very happy to have you here, ma'am. Please welcome.
Hello, good evening, Hema. Very happy to be here too. Yeah, and hello, everyone.
So nice to have you, ma'am. To start off, please tell us about yourself and your journey of starting Amaze Charitable Trust.
Well, the journey which led up to Amaze started much before, quite some years before that. As you mentioned, I'm a parent of a young man with autism. He's 26 years old. So when he was around 2.5, 3 is when we heard the word autism. And it was a word we had not encountered. And that is what started the journey towards this space. So at that point, I was working in the software industry. And I felt at that point that my child needed my attention. So I decided to focus on, what he needed, from me as a parent as well as for himself with this difficulty.
Yes.
So that whole process is what led to Amaze. So it was a journey from Amaze was started in 2012 and he was diagnosed somewhere in 1999. So it was a journey of 10-12 years that led up to Amaze. So in the process of trying to create a support system for him, a learning system for him, because he was a child who was very different, who did not speak, who learned in a different way, who needed to be engaged in a different way. So not necessarily every therapy or every mainstream system that we went to, suited him. So around the age of 6 is when I realized I have to take things, in my own hands. I have to learn how he learns and then help him learn. So it was a complicated process like that. And so I started learning a lot of things, including the first thing was how to make him communicate because he is not speaking. So I had to learn, and those days there was not workshops and, social media was not active. So I learned from a book, a manual, how to make him communicate using a picture system, and then how to make him learn, how to make him type. These were all challenges for him because he had a motor planning difficulty besides autism. And he also was very active. So for him to be engaged and sit down with something he is not interested used to be a challenge. But still, I did not want to give up also on the idea of him being an equal participant, whether be at home or in society. Or with school or whatever. So there was this whole learning process I went through about him, about autism, about myself, about the world. And in the process, I felt there were some gaps still. Like, for example, I felt people were not using so much of technology as assistive technology, as a tool to bridge for these children who were having some difficulties. Similarly, I felt there were not many, social opportunities for them to explore, whether with, the community or with their own groups. So these Amaze was started out of all those needs, that I felt there was not enough skill training happening for those who had moderate to severe difficulties like him. So with all these things in mind is what, Amaze was born, so that I can create a support system for him as well as for myself, a space where he can operate, as well as people like him can be trained and operate.
Very good, ma'am. As I was trying to know you, like one very interesting thing was we are very excited to know about the unique adventure camp for the special people you organize.
True. Amaze actually offers a number of, like on a day-to-day basis, we are very well known for our adventure camps, but I'll just come to that in a minute. Because what we do day to day is to work with young adults and adolescents with autism for skill training. And we use technology as a bridge to help them to get their literacy and communication. This is our core capability and some sort of a niche offering that we give. Uh, but at the same time, as you mentioned, we also do a lot of community outreach, and one of them is this adventure camp. So it just happened that we are all nature lovers at home, and we used to go out every weekend, maybe for a trek. In fact, we shifted from Bangalore to Coimbatore because we are surrounded here by more hills and opportunities. Easily we can just drive up to a hill and climb it or cycle around the place. So and this was something we engaged as a family. All of us were very active. I do have a daughter who's younger to my son. So the four of us, my husband, my son Nishan, my daughter Nivriti, and all of us used to go. And in the process, we discovered this space where they had adventure activities also, which my son seemed to enjoy. And we thought, why not then have such camps where other children also come and they have an opportunity. This was even before Amaze was started, that we started having these family camps, so to say, in Kunur, which is near Ooty. And we live in Coimbatore, so it was quite nearby. And we started going with a few families. That's how it started, in an informal way, and then it grew to annually we used to have couple of camps, usually in the third week of April and sometimes in August period also. So we've conducted more than 20 camps where the child can come. They should be above 6 because all the safety equipment and all are suitable only for slightly older people. Otherwise they may slip through it, as well as they need to be mobile. So we were not looking at specifically autism, but any disability. If the child had special needs, if I might say that, they could join us, provided they were mobile and they were above the age of 6, and they could come with the parents, so that the parents are there to support and encourage the child, as well as experience the adventure activities themselves. So they were very successful. And what we found that during the camp, the children overcame a lot of their fear. Their risk-taking abilities improved. There was a small social network formed between the families who joined, and they were quite carefree because this is a non-judgmental environment where every child is like their own child. We found the parents supporting each other. So we found this to be something very positive. So we continue doing that. And from 2016, we have had the camps in another site in Pune. I partner with First Light Consultants, and two of my friends, Rajendra Pawar and Padma Ramani, support me. The camp in Kunur is hosted by NALS, which is the National Adventure and Learning School. So the leadership school, which is headed by Lieutenant Sheshadri. So these people have come forward. They run programs for neurotypical people, but they've come forward to support us with our camps.
So you take only with the family or even the kids alone?
So both. Initially, it was a family camps only, but what have we from 2018 and 19, we had two camps in Kunur, which we call as a life camp, the life skills, independence, fitness, and exploration. So that is the acronym for life, where we take young adults without their parents also. It was a huge success because the children learn to be more independent. Parents also felt, comfortable and confident that child is able to go somewhere within them, because the greatest fear that as a parent of a person who has special needs is, what will the child do when I'm not there? So this also was a proof of the concept that the children can do well without.
We were all eager to know how like what was the feedback from the parents and the person who enjoyed the camp. To take off first time,
No, the first,
independent.
yeah, first time independence, they really enjoyed it, and I have because after that COVID struck in 2020, we've not had the opportunity to do that camp again. So I would get repeated messages from these young adults, the ones who are able to use WhatsApp and speak will call me and say, ma'am or auntie, when are we having the camp? And, they really look at it as a space where they can explore themselves, be, independent, really empowers them in a sense. Whereas the parents, initially they are very anxious. And so we usually create a group and we keep updating them of the activities, sharing the photos. Then they're quite amazed. Oh, the child went through the routine on their own. They did all these activities and they're still not tired. In the evening, we'll have some group activities, singing, dancing, games. And they have so much energy and they didn't, really have a meltdown or a tantrum. Almost initially the parents have a disbelief, and then of course they are very proud of their children, and they see that filtering into other spaces where then they are able to not so much make their child dependent on them for day-to-day activities. When the child comes back, we see them giving more responsibility to their child, exploring other activities which are similar, where the child can go on their own. So it is certainly something that brings uh, a shift in the attitude for the child as well as for the parent.
It was really amazing, ma'am. And because you're related to technology and you have been doing a lot of things, kindly tell us about how you empower the young adults.
Right. So we have two types of programs. We do have a program for children who are 5 to 15 years, where we use technology as a tool through apps, through certain programs to improve their communication and literacy. As well as for the young adults, if they are not able to work. So when we look at the 5 to 15 age group, some of those children may be attending an inclusive school or a mainstream school. They may be struggling in these areas. So we take their content and make it into simplified worksheets that they can practice. And somehow they find technology based, content easier to process than having to say, for example, if they have to learn a spelling and you have to make them write it 10 times, it's something very much difficult or boring. It may be difficult because they have motor skills issues, or it may be boring because they have attention issues. But if you have a worksheet where you have to in indirect ways, you have to match, type, drag and drop, you're not actually all the time having to recollect it. It sort of is an interactive process, also keeps the attention, keeps the interest going, and in the process they learn not only their content, meaning whatever is their school work they are learning or whatever is the goal, but they also learn technology skills, which are very important in the current age, because everything we use technology now. So they become equal to their peers who are also all the time using technology, right? If you see, even a young person is very easily, 10-year-old child creates a PowerPoint, is able to, I'm sure you work in early education. But
especially after this
corona. Yes. So to make them on par with that, as well as use it as a tool, because technology is multimedia, right? You have all the senses can be stimulated. You can have the voice, you can have a touch interface, you can have something moving, you can have a GIF, suppose they need to understand. For example, if you're taking a lesson, say, on how to deal with anger. So what are the symptoms of anger? Your breathing is fast and you're sweating. So you can have small gifs, where they see all those, and it makes it very relevant for them. And it's also customizable very easily then, because this child may have a certain way of learning, then the other student may have a slightly different interest. If you take a math worksheet, one child may like to count the number of tomatoes, because that is a favorite vegetable. Some other child may count the number of chocolates. So easily I can change a worksheet to have content that keeps the interest of the child. So I'm just giving small examples there, how we use technology to keep the interest and adapt to the learning style of that individual child. And when it comes to communication, it's a huge tool, because say for my son, he is not verbal, meaning he does not speak, but he has a lot to say, even though he does not speak. So he uses an app which is called Amaze to communicate his basic needs. So on one touch, he can say, I want water, or I'm feeling hot, or he can say hi or bye. So it sort of then gives him a voice. And also he uses another app called Clicker, where he types and that speaks out what he types. So speech to text, text to speech is there. So that also helps him to do his academic work, or be a part of any kind of discussion like this. Suppose he has to be here in this discussion, then he would type, but his voice would still come out through the app. So it sort of is a bridge to inclusion, according to me. It's a very important thing.
Very true.
That all children should have access to. And that is what we're trying to create through Amaze programs.
It is, in fact, amazing, ma'am. And I would like to know a little bit about regressive autism.
All right. Regressive autism is what, say, for example, Nishant had. So till age 1.5, 2, he was progressing. His milestones were normal. He was walking. He was even talking. He was socializing and all that. But at some point between that 18 months to 2 years, we are not able to pinpoint. We saw that it was becoming a little less. He was not talking as much. His eye contact dropped. He started having some sensory issues which were not there till then. And at that point, we were not aware of this term autism itself, let alone regressive autism. But that itself is a sign. And nowadays, if you look at the DSM, any regression is also considered as a red flag for autism, because maybe the child is saying things and interacting in a regular way, but there are some triggers where, when the around 2 years, language starts developing and consolidating. When the brain is consolidating, that there are some processes that don't kick off. And usually, for example, a 2-year-old child will parrot things, will mirror things. Maybe something like that is not happening. So then we see that there is a big gap between the child development and the peer, the same age peers. We can see that there is a gap, as well as the child has lost certain skills. That is what we call as regressive autism, and that itself is a red flag. If a child is losing words, it doesn't happen. Normally, children progress, right? As you grow, they learn more and more things. So it is an important thing for parents to look out that it could be, and it only happens in very few disorders, and one of them is autism. So it could be a red flag that you need to immediately, consult somebody for a intervention and diagnosis.
Okay. What are the other things you were supporting the kids, ma'am, with the technology?
So, like I was saying, I did not expand much on our adult program, young adult program. We call it AMEA, the Amaze program for mentoring and empowerment of young adults. So what we found was that many of the young people with autism or related communication difficulties are not able to, probably not all of them, are able to get into the academic stream. So then if once they miss the bus there, then, there were not much scope for them as to what they can explore. And at that age, the literacy and communication was also not something that, parents or educators were focusing on. So even at that age, when they come in, similar to the younger children's program, we do have a literacy and communication program, which is digital, computer based, which works on a content that is not academic. So we take their life skills, we take cooking, we take all this as the content and help them to learn basic reading, writing, typing skills, as well as communication skills. So that is one part of the program. And in that process, because we are using apps, we are using, Microsoft Word, PowerPoint, etc., for them to complete their work, they also become digitally literate. So it is a combined holistic program working on their life skills, working on their literacy, as well as their digital skills. So this is one part of it. We also help them to explore many things in their, like art, music, sports, fitness. So they usually have a whole day program. Before COVID, we had a whole day program. Now we've just resumed. So we are in 2 batches, 2 half-day programs are going on, where they explore all these areas, cooking also. So, yeah. So there is computer skills, there is, or technology skills, if you want to put it that way. There is cooking, there is art, music, there is sports and fitness, and there is any other interest they may have. So when we explore all this together, we get to know their areas, their strengths.
Yes.
And then we work on those strengths. So suppose somebody is really good at cooking or interested in cooking, then we increase the scope of that program, the skills relating to that.
Okay.
And then we try to put them out into real internships outside with, in the mainstream, like maybe a baking internship. 4 of our interns have done baking internship. Few of them are doing a farm internship, where these children only wanted to play with the mud and pull the leaves. And, usually it's considered as a problem that at age 16, you are pulling leaves or you're playing with the mud. So we thought, why not, take them to the farm and see how they will work there. And we have a partnership with the farm. So all this is done in partnerships with mainstream. So Amaze itself is not an infrastructure heavy organization. We just have one small space, but we try to go out in the community for these internships. And some of them are also, like, after getting trained in the computer skills, they are doing some digital work. Some of them are doing some content development for us itself, for the other programs.
That's really nice.
They also make some teaching aids, laminated teaching aids. Okay. So all this kind of thing is sort of, it's not like a product based thing. It's not that he has to learn to make X product, but we go through the process of exploring, and if they are interested, we push it further. So at the end of the day, at the end of 2 or 3 years, we know we have a roadmap which says this is what the schedule that is ideal for this child, and these are the skills they have, these are the strengths, maybe these are the challenges, this is areas to improve, this is the kind of say job they are suitable for. So we come up with the entire profile as well as a roadmap, not only for vocation, but for their everything, the life skills, their fitness, all the areas.
Yeah, fitness is one of the important ones, right?
Absolutely. Some of our interns and students who are into like fitness, all these are life skills, right? Everybody needs to be fit. Everybody needs technology skills. Everybody needs to know to cook and do their, daily living tasks, housekeeping tasks. But if they are interested, we push it further. So we have some of our interns who do regularly 3 times a week. They cycle 7 to 10 kilometers. And we have a couple of them who even do more. They do 50 kilometers. And they are going with a regular cycling group in Coimbatore during the weekends. They go 150 kilometers. So if that is the passion, then we push them to that level. Or we have another intern who was interested in music. So we could train up to a certain level. Then we put him in a mainstream music school, and now he's completed his Trinity grade 2, music, and he's learning vocals. So we don't necessarily teach everything. It's a space for them to find themselves, actually.
But you're doing the base, like you're acting as a bridge. That's more and more, very important, and it's really good. Yes, ma'am.
So it is based on the belief that, usually as a parent of a 15, 16-year-old, we're worried about the future, even with a neurotypical child. What are they going to do? What are they going to become? And at least, for a neurotypical child, you may explore certain avenues in a college, or, give certain vocational training, etc., depending on their interest. But with these children, we are quite lost, right? They are not able to express their interest. They may not have enough exposure till that time. So we go through that bridging process for a year or two till it is a little clear, and then we put them on to wherever they can benefit the most. So that is the role I think we play.
Very great, ma'am. Very nice. Very happy to know about you. It's been great. I'll just find out. Yes, ma'am, please.
Some questions, isn't it? There are some questions in the chat, is it?
I'll just check, ma'am.
So there is a question which says, most of us as parents are concerned about speech therapy and the speech of the child. And we heard you talking about the importance of communication.
Yes, ma'am.
Please make us understand a little more about this. Absolutely. So while I'm speaking now to you, and it's a very important tool that I have to communicate whatever my thoughts and feelings are. It is not so easy for a child with autism, right?
Yes.
To do that. And while it is very important for them to develop speech, meaning, we need to understand that there are 3 components. Speech is not just, automatic. The child also has to understand language, which is a cognitive, like a mental component. They understand the meaning of things, how it is represented. For example, if I say BLUE, that is the color you are wearing and I'm also wearing. Yes. And we know that it is the same meaning for both of us. But the same thing, that is what is the language element. But for the child to say blue, is a speech element. Yes. But communication is the third aspect, where maybe the child wants to wear a blue shirt and he has to be able to use it. We call it the pragmatics of speech, where they're able to use it and communicate, share their thoughts and feelings. So that is where autism, the children have a difficulty with. Mostly. Though there are children who also don't speak, but many of the children with autism will speak. In fact, they will echo many a time what you're saying. So if you say, what's your name? They'll say, what's your name? So they are using speech at that point. Either they are not understanding the language. What is it, like if we now both of us are Tamilians, நம்ம தமிழ்ல பேசினா அப்ப மிச்சவங்களுக்கு அவ்வளவா புரியாது. So language is a factor. So that's what I'm trying to say, that it is maybe because they don't understand the language. Yes. But the third aspect is that I don't know how to use that at that particular point. Yeah, so many of the children do have speech and they understand language also, but they are not able to convert that thought or the intention they have into a meaningful exchange. Yes. So they just repeat. That is what happens, or they don't speak at all. So it is very important that a person working on the child's speech and language also focuses on the usage of it in a practical way, and then you can see that the child is able to function better, whether it is in school or whether it is at home or with friends or whatever. Many a time the focus is on the child has to speak and they lose out on not learning to communicate. communication has so many other aspects like the tone of the voice, the
Yes.
facial expression. For example, I may say, Hema, you're looking so nice in the sari. So there is you know that I'm being genuine.
Yes.
But suppose I say it differently. I say, Hema, you're looking okay, nice in the sari. You know I don't mean it. Just
Yes.
though I say the same words, I'm
Yeah.
using speech,
Yeah.
I'm using
Yeah.
language.
Yeah.
Just by the tone, I'm communicating something.
Yes.
So there is also an aspect of communication which is other than speech. That part also, even for the children who are speaking, we need to work on. And for the children who are not speaking, we need to give them an alternate way to
Okay.
communicate through
Very
technology or pictures or signs or gestures. We need to help them to express themselves, and that will empower them.
Very nice, ma'am. Very. And then there is an appreciation. Very happy, ma'am. She says it's very nice. It was very, very informative. And in fact, I also came to know a lot of things. And I'm sure the parents would have gained a lot of confidence and happiness, because as you train and as you told, when they become independent, the parents are the one who really,
Yeah, it is very important to include the parents in this journey. So at Amaze, we usually have an open door center. So the parents can come and be a part of the sessions, the intervention sessions or the learning sessions. So they also see how their child is learning. They can also give inputs. They know their child best. They can give inputs about their child, which will enhance the quality of the learning, as well as they can learn strategies from the teachers or the specialists as to how to elicitate some response for communication or learning. And they can include this in the day-to-day life processes, in the learning spaces. They can take whatever they are learning here. So that kind of approach, at the end of the day, like if you take Mutumari, who has commented, she was a very involved parent, and she learned and she took it beyond even what we taught her. But being open to share with her all the strategies, all the things that she needs to use with her child, empowered her and empowered her child. And she could take it, she got the confidence that this is how I need to teach the child. This is what probably I had to learn on my own at that point, because I did not have sort of a mentor. I did have a few people mentoring little later in my life, like how to get my son to type. I did have a very good mentor in a person called Shoma Mukhopadhyay, who helped to a different method to sustain his attention, called rapid prompt method, and get him to typing. So they were guides later on, but at the early stages I did have very good support in terms of therapists, but they were not aware of how to bring forth certain skills in a child with autism and apraxia, as they call it, the motor difficulty, which was preventing him from speaking, as well as some difficulty with focus and attention. So, yeah.
We understand that. Please guide us how to look beyond autism, like.
So, see, as a parent, it is normal when you're, when you welcome this child into this world with a lot of positive expectations.
Definitely.
The birth of a child is a really joyous occasion. It's a symbol of, for the whole family in India. It's a big family affair. The grandparents, the extended family, everybody is so happy that the child is born, and we obviously think that the child is going to go in a path that is beyond even us. Our wish as parents always is, in a minji irukano ennoda kuழந்தை.
எனக்கு 4 தெரிஞ்சா என் பிள்ளைக்கு 40 தெரியணும் அப்படி.
So அந்த மாதிரி expectations, we expect our children to go beyond us also. So in that, when the child is around 2, and that's when average the diagnosis for a difficulty happens. And if it is autism, it, at least now it's more common, but earlier, when there is no you can't relate to it at all, that what is it that has happened to my child. It can be frightening, it can be overwhelming. So at that point, is a very crucial point, where we need as professionals, we need to support the family and the parents to get through that point, and to go to a point where they see that this is the child is not defined by that disability alone. That is a part of the child. And there are things, they are still a small child, they still look as cute, they still have needs, which are the same needs. They still need to learn, they still need to grow. They are a joy still. The child is not aware we should that they have something different. So as a parent, the first thing is to not make the child conscious, I feel, of that, that they are having a difficulty, challenge, rather to keep encouraging them that they about all the positive things that the child has, whatever it might be. Like, for example, in my child, I found he was very active and very keep his energy would energize me, because I could not sit in one place. I had to keep engaging him. And for me, that was something very joyful, that he was so engaging, and that I had to keep thinking of new ways. So just like in an IT job, I like challenge, I like to create new products, I like to interact with clients. So it's the same thing. It is.
So it was very helpful here. Yeah.
No, so the same thing, if we just transfer to our child, we also will get the same results like we get in our job. So rather than think of it as a burden. And if we follow the lead of the child, many a time we are going against the grain of the child. We just want to reach a particular goal, make them normal, so to say. This is every newly diagnosed parent has this thought. When child normal aguma, when child these are the questions they ask, right? So if we can, but we accept so many new normals, right? COVID is only the latest. Before that, there is we use so much technology, social media. Our dressing has changed, the way we eat has changed. Many of us went abroad, we adapted to a totally new way of life. So this is also just a small change in the way of life. If we look at it that way, and adapt and understand that new way, while not losing ourselves. I'm not saying you have to give up your way of life, but to bring in that new way of life, that also helps a lot. That to sort of accept the child, and as they grow, there will be a lot of things you discover that they are interested in, and to take that forward. Like my son was always, he's a foodie, loves food. So we explored, cooking, baking, all those things. Now, as a young adult, he's not so it gave a platform. So any life process, we are only looking at inclusion. They should go to a particular school, they should get a particular degree. But if you look at the life processes, and we can include them day to day in our own family, in our own life, there is a marked change in the child and ourselves also, I feel.
And there is one more question in the chat, ma'am. That is from Purnima Shivaraman. A grandparent wants to know if it is good strategy to teach with the play card and object together same time.
It depends on the age of the child. I would say that the best way is to teach a child is through the motivation. So initially, if you're trying to teach the child to communicate, so you look at things that motivate the child the most. Things, favorite, they could be favorite foods, favorite people, favorite activities. So, can you have, those objects and get the child to be able to, ask for them, or label them, etc. Yeah. And then look at things like our children with autism have certain things, like they like a routine, they like a schedule, they have certain things they want to, certain times they are very sensitive to. So these kind of things, the certain kind of prompts. So these kind of things will help, like you sabotage something in a routine. Every day morning they get up, they brush their teeth, you hide the toothpaste, and then they should can have a picture of toothpaste so that they can ask. So now the question is, in that, should the wording also be there along with the picture or object? Should the wording be there? For a very young child, I'll say it's not necessarily so. But as they grow older, rather than have it separate, have a picture with the word written on top. So they scan it together and they associate and store it together.
Very good.
Yeah. And around the house, you can label, once a child is at a pre-reading stage, you don't need to do it. If they are not communicating at all, it is not necessary. Communication should be the first. But when you are moving to literacy, you can label everything. On the table itself, you can write table. On the fridge, you can write FRIDGE. So they are actually seeing the word on the objects. And that if that is the stage that child is in, it will help.
Any message for the parent on the role of the community, ma'am?
So we were talking today, in our center also about this, and talking about what is true advocacy, right, for our children. So the first thing, the parent, if they can, overcome their anxieties and fears and start taking their child out into the community. That itself is the first step of awareness. Wherever you're going to the shop, you're going to the restaurant, you're going to the wedding, you're going for a walk, please don't just leave the children at home worrying how they look or how four people will say something, because just by taking them out is how you can create awareness. When you take them out, there may be people who are curious, who ask you questions, who say, I've even my son used to cycle, for example, and then I've had somebody ask, why are you bringing him cycling, on this road? When is it not dangerous, kind of thing. So I had to tell them, see, he does have autism, and he is training to be he's cycling quite well. His balance and everything was quite good. He's cycling safely. And unless I take him out on the roads, he will not learn road safety. I'm accompanying him. So as long as he is not disturbing anyone, he also has a right to be on the roads. So that way I can create awareness with that particular person, that yes, such children will also be there, because many of us grew up without seeing any of them. These are the invisible sort of people, right? We didn't see them on the roads. We didn't see them in the schools in our generation, because they were just kept at home. So the first thing for the parent is to take them out, and also to create awareness among spaces, like, if they need to, for example, in the child's school, it is important for, say, the parent can have a meeting with the school organization, the teachers, to talk about the difficulties as well as the skills that the child has, a special, like many of our children are very, very, down to earth. They don't have an ego. So many good qualities. Also, we can talk to, and they complete their work on time. They are not wasting their time talking or avoiding work. They don't tell lies. So these kind of things also we can, as we talk about their difficulties, we can talk about their good qualities, and bring awareness to the teachers, and at some point even to the other parents who are sending their children to the school, so that there is a positive way in which they are included. We first of all should feel comfortable with to do this.
Yes.
And if we are finding it difficult, I think it is good to take some counseling, some help, so that we deal with it. We are comfortable with this, and then we go forward. Because all of us cannot automatically maybe, be able to feel, okay with this whole thing.
Definitely. And ma'am, you said something about PECS. What does it mean, ma'am?
I use the word PECS, maybe it's a picture exchange communication system, and this is a system that I implemented for my son when he was around 6 to help him start communicating. So he, at that age, he was able to understand pictures. He could point, like if I said point to bus, he can point to bus. If I spell bus also, he can put together, like he went to a Montessori school. So he could put together the movable alphabet BUS. And you know, sometimes we saw a bus, he would say bus, bus. But he could not say, okay, I want to go in a bus ride in the bus today. You know, do you want to go in the bus or the car? So he was not able to connect his thing to that. So the picture exchange system is where they have separate pictures, and then you train the child in a particular way to start communicating that. And then he started communicating after 6 weeks of implementing the system. He was able to communicate his basic needs. So it's a basic, yeah, it only took 6 weeks because he was already familiar with all the pictures and everything. But for a child who's not familiar, much younger, it may take a little longer, maybe 6 months. But it was a turning point because once he could tell his needs, a lot of his behavioral issues like his anxiety, his crying, or his, you know, stress came down.
Okay, ma'am. Any tips for the parents to look after their mental health and well-being?
No, it's a very important thing that you know, parents need to take care of their mental health and well-being, even their physical health. Many a time we don't have, you know, parents don't eat properly, they don't sleep properly, they don't have a fitness routine. So that itself is the first step in a, you know, to reduce their stress, to find little pockets. And many a time they may not find separate time to do that. So I would say that you do it along with your child. So I would go cycling with my son. I'm not done it for the last 10 years now. But till I was able to, my health allowed it, I would go cycling with my son. And so I was a part of his fitness routine, which was also keeping me fit. And at the same time, you know, he was also on a, you know, on a diet because he does have some digestive issues. And that helped me also. So I think, you know, I would sleep whenever the children sleep, relax when they relax, so that, you know, I also take care. That's a basic thing. But beyond that also, for when I felt stuck, when he was around 6, I felt really stuck and I didn't know. I had thought that if I put him into certain therapies, he is going to be okay after a few years. At 6, 7 is when I realized, no, this is something lifelong. I may need to train him. So I did go through a period of not feeling okay. I had withdrawn. I was not my bubbly, chatty self. I was so to recognize those signs that we are not ourselves and we are not able to give the 100% to our child also. When we are not ourselves, what happens? We are irritable or we are withdrawn and we are not able to be there for our children. And in that, we may be doing a disservice to this child who already has a lot of needs, different needs. So at that point, we both, my husband and I, also were having a lot of arguments on different things. So we both sought counseling, and I think counseling really helped, you know, us to come out of that and get a new perspective, to convert all that anxiety, I would say, and anger into action. That is really good for both us and the child and the whole family. Definitely. And in fact, that action has gone forward also. And, you know, we've created Amaze and all that. So whenever we do go through periods where we are anxious or we are, you know, not able to understand what to do next, because this is a new road. It's a road not taken. So we have to find our own path at some point. But at that point, to just take a pause, to get whatever help, you know, in whichever way. For us, counseling help. For somebody else, meditation may help. For some, whatever way that it is, that you can regroup yourself, re-energize yourself, and then come back and face whatever is the situation. Because life is going to throw its cards, you know, just like any other family. There could be financial issues, there could be marital issues, there could be health issues, there could be other responsibilities that we need to carry out. And we
Very
need
true.
to,
Very true.
juggle these balls all the time, and that is going to cause stress. So this is a given. In a special needs family, it's a given that stress is going to be there. So we need, like, just like, to be on a preventive health care, also
Yeah.
preventive mental health care, I would say, to take enough pauses, to pursue something
Yes.
that energizes us, to spend enough time with each other as well as away from each other. Everything is
Very true. Very true.
yeah.
What should be the role of the community, ma'am?
See, the community, we cannot dictate, what they will do. The community is there, right? And life goes on in the mainstream community. Things are more driven by the law of survival, right, over there.
Yes.
So the best man wins, the best person. So it is that kind of community that we live in, especially in a third world country like India.
Yeah.
Economics also drive it. So everybody has to somehow survive. So this is what it is. And in that race to survive, many a time the community is indifferent or not sensitized to the needs of those marginalized, like
Yeah.
those with
Yeah.
disability. So that is true. So people like Spectrum Autism, your group, and people like me, in your case, you all are not even connected to disability, but you all have come forward. But in my case, I'm connected. So even more so, I have a responsibility to make, first of all, our voices heard,
Yes.
and to be out there, meaning, in a full form, so that no people know, okay, child with autism maybe will not communicate, maybe will have a meltdown, maybe, and
Yeah.
this is normal. If they have autism, this is their normal. And
Yeah.
to have a community, to have the supports for that, like a simple thing. Every mall, for example, can have a small space, like where if a child is feeling overwhelmed, they can just go and sit down and rest, a quiet space. This is
Yes.
what a child with autism needs. Or even a doctor's office needs to have this, or a hospital, a
Very
small
true.
waiting area, which is, where the child is not feeling overwhelmed by so many people around, or the
Yes.
noises or something.
Yes. Yes. Yes.
Simple thing like that. Something we did in Coimbatore and Chennai, along with a Special World, which is another parent forum in Chennai, is we worked with Satyam Cinemas, and we had this movie every month, every first
Okay.
Sunday of the month,
Okay.
which is we called it a sense show. So the sensory friendly show, it'll have dim lights, lower volume. So we could get a mainstream cinema theater group to have one
So
show of the latest film. It is not some cartoon film, latest
okay.
film.
Okay.
So will be shown, and even 3D, some of our children can't see, so 3D will be converted to 2D and shown on one Sunday. And this
Okay.
really helped, the children to come out. Parents felt confident to bring them to the movie theater, and then it was a whole experience. And after a few times coming to these shows, even some of the children were able to go for a regular film,
Okay.
not necessarily sensory friendly.
Yeah.
And so a new avenue for socializing had come for them, where they could go out as a family. Or till then, even I faced it with my son, where after a certain period of time, as a young child, he could not take that loud noise in the
Noise.
theater. After 1 hour or so, he wants to leave the theater, even though he likes the content. And over years of desensitizing, after that only he could see some movies which he has a lot of interest, like he likes Disney movies and things to do with animals and all. So
Yeah.
such movies he would be able to sit through, but it was a long process. So this sort of an initiative really helped. And you know so taking them out helps, like, even shopping, for example, whatever
Okay.
is a nearby shopping mall, or shopping, grocery or vegetable shopping, taking them everywhere, so that, they also are involved, they also learn a skill, as well as the other person gets to know, oh, there is a child like this is what they can do. They can actually ask me, like our students would go out in the community,
Yeah.
and they communicate through the tab, something like this, an iPad, or it's an app, I can show it to you, like this.
Okay.
So they can ask, they can say, I want 2 kilo potato through this also. So it is an awareness for that vegetable vendor, right? That there is a different way of communicating also.
Yes.
And all of us used it during COVID. We WhatsApped our list to the grocery shop. So it was done by the digital mode. It's nothing very different. Or in a restaurant, to be able to order using, a different technology, asking your child to order. Maybe that waiter has to spend 2 more minutes if the child is not very clear in the speaking, or they are using an alternate technology, but it brings an awareness. So I feel a role of community will come once the community is aware that such differences, we can call it neurodiverse individuals exist, and they also bring value. So that's the next step, which is happening. Thankfully, it is happening in India, where there are even corporates who are hiring these individuals who are neurodiverse for their skills. Like for some children with autism have very detailed visual skills. So they are being hired as, graphic user interface testers, because they can find the errors very easily. Or some of them are very good at, tasks, even I think some hotels hire them, because if you give a task list to say clean the hotel room, they follow that thing to a T. They don't leave out anything. And they're perfect in their job once they are trained. So these kind of special abilities they have, special attitudes that they bring to society. If the community becomes aware, then they will be ready to be more inclusive, because that is, as I said, it's a jungle out there, it's survival. So they need to see value in inclusion. And we have to train our children to be of value. We have to take them out there. And also, they also then have to create be open to those opportunities.
Yes.
And somewhere people like you guys are the bridge who take this to them. Thank you so much for that.
Thank you, ma'am. Thank you so much. It was really wonderful. You gave us so much of information in such a small time. Like, it was very good. Thank you so much, ma'am.
Thank you, Hema. Pleasure speaking to you.
Same here, ma'am. Now I have a small request for the audience. We seek your support for the inclusion drive. The link to upload your inclusion pledge video is given in the comment section. So the viewers can take the pledge and post it in the link. So it will be helpful for us, and it will be useful for most of us. Thank you, ma'am. Thank you. It was wonderful.
Lovely.